great to be here, and thank you so much, Wendy. So, MIT, I am from class of '88, so I am in the right place. That's a good start. And so I actually studied biology in the end, after chemical engineering and French literature, and enjoyed it very much. Very hard time, of course, as well, as we all recall. And I lived in Theozai across the river. And some of my memories that I still tell my patients, I'm a doctor, over and over, is that I love those shirts that said "Spam it." Stupid people at MIT, because that's how we all felt, like everybody else is a genius and we're just, struggling to get through, of course, the challenge of learning the material. So I tell people that, and I also tell them that, for me, my experience was, my experience as I related was that the smarter you were, the quicker you figured out you're not the smartest one at MIT. So that's really my 2 cents. So it's a great pleasure to be here, and let's just see if I can, first of all, operate this, but I'll just go this way. We'll get started. So, as I said, I'm actually a physician. I'm a sleep specialist, and so the lecture is going to be about sleep. And so, if any of you fall asleep, it's okay. There's no problem with that. And so I'm part of the largest group of ear, nose, and throat doctors in the country. It's called ENT and Allergy Associates. I got there through a long journey. I went to the medical scientist training program at Mount Sinai after I left MIT, and that's right after I went into doing some computer science work. But I wound up in medicine, and I've been involved in various ways academically, even though I am in private practice. Oh, sorry. So, no problem.
LSC.
Hi. I didn't hear the refrain. Okay, good. All right, so that's Rockefeller Center and some other words, and I collect degrees too over the years, so that's my hobby. I'll be talking about advanced techniques and technologies for sleep apnea as briefly and as quickly as possible. My apologies about the speed. I do have some disclosures, some scientific advising, and some consulting for some companies in implantable neurostimulation for sleep apnea, as well as a new treatment for nasal obstruction with Aaron Medical. And I found this really cool picture of MIT here. So, okay, in case you couldn't recognize it. So, let's talk about sleep. So sleep is not a passive state. Sleep is a really active part of our daily cycle. The memory is being pruned as well as being fortified, depending on the stage of sleep. It's critical for the brain. The brain actually does a toxin elimination process that occurs in sleep, so the beta amyloid deposits that contribute to Alzheimer's actually get washed out of the brain during sleep. So sleep is critically important, and not just for the brain, but for every cell and every organ in your body. And so if you want to reach Zen, you gotta sleep like the Buddha, okay? And do not follow this, which is what we're taught, right? Yeah, you can drink, right? You can sleep when you're dead. Wrong. Actually, you'll get there if you don't sleep. So sleep is critical, and ignore what you've been taught to do, which is wrong. And this is why this is the number one most prescribed drug. The number one drug in the world is actually caffeine, not prescribed. Okay. So you might appreciate this as long as we have sound here. Otherwise, I'll get the computer here. Okay, great. So this is what happens when you snore and you have sleep apnea. It's looking with a telescope from the top down, from the bird's eye view down the throat. And this is the throat closing in on itself during sleep. So this is the palate that's waving back and forth. This is an obstruction that's complete behind the palate. And the throat is trying to open itself. The brain eventually gets enough tone going so you start opening the throat. This is an apnea, and that was a snore, okay? So this is what sleep apnea looks like and sounds like. I'm glad you enjoy it. So what happens during this state? Oxygen will drop as the throat obstructs. Your nervous system gets activated to open the throat again, and sleep is disrupted. And as you can imagine, that's not good for your health, especially if you're doing this 30 times an hour. And this is what could happen to you. You can turn into Homer Simpson with his IQ. Okay. So, seriously, quality of life, productivity goes down, You're at risk for cardiovascular events, heart attacks, strokes, you name it. There's risk of diabetes, dementia, even increased risk of cancer. So basically every process in the body gets disrupted because of the sleep disruption as well as this issue with oxygen. And therefore there is an increased risk of premature death if you have a severe case. And accidents. 3 Mile Island, I thought you might remember this, as well as the recent ones. The Metro North in New York, for example, were because of untreated, undiagnosed sleep apnea. So why does this happen? What are the mechanisms? Well, you got to start off with a small throat. Small throat is stable when we're awake, and as we sleep, the muscle tone diminishes, and then it's collapsible. It's a collapsible, fire hose if you think of it that way. The tone goes down, and there's other things that may contribute to it. Because of this repetitive mechanical trauma from snoring, then you're actually damaging your sensors in the throat. So that could be one of the additional mechanisms. There's also loop gain. I know you love this, engineers. So loop gain and overshoot and incoordination of the breathing cycle that happens in sleep apnea, and a low arousal threshold. That means that we respond too quickly and we wake up too fast, whereas if we stayed asleep, we'd actually bring up the muscle tone to break the apnea. So just some stuff, as we say here. And now we test people. So how do we test them? We go to the sleep lab, right? You heard about sleep labs. But that's the problem. One is comfort. So this is the sleep lab and the can't sleep lab. And this is the can't sleep lab from this guy. So do you sleep this way at home? I don't think so. And likewise, lots of monitors, lots of sensors, not too comfortable. Also, there's an issue of cost. In addition to all of this, there's a technician that stays up all night, monitoring and scoring. Denial means that the patient says, I don't have a problem, I don't want to have a test. And denial also means that the insurance company says it's a costly test, we don't prove it. And then one of the biggest problems you might appreciate is limited data analysis. You get this treasure trove of data, of signal that's captured, and yet it's distilled to just a few basic parameters, and that's the score, which is, it's a waste. So that was the standard of care, and now things have changed because of those reasons. So now we talk about home sleep testing, and I'm going to talk about one device called the WatchPAT. The WatchPAT is just this. So, yeah, I could sleep like that. So we're talking about one is just an oximeter and something called a peripheral arterial tonometer on the finger. This is the device that's on the wrist over there, which is also an actigraph, as you know, that measures motion. And this is a snoring sensor, as well as a 3D accelerometer that tells us both chest wall motion as well as body position. So what can you do with that? Believe it or not, you can actually assess sleep stages from what happens in your finger, as well as the oxygen, of course. The finger also tells us about activation of the nervous system. Sleep position, we talked about. Chest movement, we mentioned. The snoring. And what's great is that it's inexpensive. You sleep fairly normally. You don't need a pillow like that. You can sleep in any position you like. Obviously, it may overestimate sleep a little bit, and it may be a little bit inaccurate in the milder sleep apnea, but pretty good. So, how does it work? This is normal sleep. So normal sleep, we have normal flow. The nervous system controls the caliber of the artery in the finger. And this is a normal signal that you see in terms of the tone in the finger, the arterial tone. This is the next case. This is sleep apnea. You're blocked. When you're blocked, your nervous system gets activated. It actually constricts the artery, and then you see the drop-in signal in the finger. Very simple analysis. So very complex stuff, but basically you have a pressure sensor as well as an optical sensor to measure the oxygen in the finger. And this, again, reflects the response of the nervous system to the blockage that occurs with sleep apnea. And at the end, you have this chart. And you don't have to look at the details, but basically at the top in the red is the PAT signal. And then going down, we could look at, for example, the oxygen dropping here. And then there's a movement signal, there's a snore signal. So you can correlate all of these and make sense of what you're seeing. Very easy to analyze. And there's also automatic scoring as well built into this device. So that's diagnosis in terms of what's new. And now the most important thing is treatment, right? Who cares about diagnosis? Let's help those people. So in terms of treatment, this is the nice side of PAP, which is air pressure. If you pressurize the throat, you inflate the balloon and it's not obstructed. So this is the beautiful side of PAP, where you've got smart machines that adjust themselves to you, and he looks really comfortable in bed and everybody's happy. But this is how some people look at PAP. Say, hey, listen, this is MIT, I gotta show some Star Wars, come on. So this is how some people look at it. They said Darth Vader mask. Likewise, this is one of my very happy patients with oral appliances. Oral appliances move your jaw forward. By doing so, they put the throat in traction, stabilize the walls of the throat. So he's a happy customer, but others think of oral appliances like this. So, and that's the problem. The problem is we got to match the treatment to the patient. I can have the best treatment. If you're not going to use it, it's no good. So, and I also do reconstructive airway surgery, and this is how some people view surgery. The knife, the big knife, which is how some people look at it. So now we talk about something very relatively new, which is neurostimulation. Why is this analogy here? Well, again, it's MIT, so we got to bring Star Trek. But no, there's a reason for it. So here's Captain Kirk. He's all young and dashing and handsome young fellow. And then guess what happened? He got older. He's doing Priceline. He's a very talented man, but he got older and he got sleep apnea too. Okay, he's using CPAP actually. So, but if you go back to this analogy, think about all this stuff they were using and how silly it is. Where now my iPhone has so many biometric sensors on it that this is funny. So the future is here. The technology has made it possible, and so we know that the muscle tone is abnormal in sleep apnea. In fact, if you have sleep apnea, you're using extra tone to keep the throat open when you're awake, and you lose it when you go to sleep. And if you experimentally activate tone, you can open up the airway. And by the way, this is a tongue. You can see how big a tongue is in a sleep apnea patient and how much fat it has actually in sleep apnea. So we know that just as basics. And then we have a system that was invented, it's CE approved in Europe, and in the US it's still in the pivotal trial. And it's real simple in terms of the components. You have a sophisticated pulse generator I can make this work, it'll be even better. But it's basically placed under the skin of the chest wall. You have a remote control that activates it, and the end of the loop there sits on a nerve here, that's the hypoglossal nerve to the tongue. So it activates the nerve to the tongue, and that activates tone in the throat. Now, it's more complicated than that, of course. How does it work? Well, it has to do with the fact that the tongue is a hyperstat. The tongue is this amazing organ that's got muscles that are attached to each other, and they actually generate force by attaching to each other and forming complex shapes and functions. It's just much like the chameleon's tongue or the elephant's trunk. The second thing that's very cool is that the hypoglossal nerve to the tongue is not fasciculated. That means that you don't have all these barriers between the fascicles and the nerve, so if you stimulate from the outside, you can have current spread on the inside of the nerve quite easily. And finally, it's resistant to fatigue, so you can stimulate it on an almost continual basis. So now we have this cuff that has 6 stimulation points on it in the silver there on the right. And what we do is we stimulate it in time. We'll choose 3 contacts, and we'll go 1, 2, 3. Different contacts, different points in time, different parts of the nerve. And this way we don't create fatigue. That's the idea behind this stimulation paradigm. And this is just, again, the IPG. There's our charger every couple of days. And let me just show you this, because this is the interesting stuff. Now I want you to look at the tongue. This is looking at the tongue base from above. Look at the walls of the throat. And tell me what happens. And so this is what happens when we stimulate. So I'm going to run like 1 minute over, I think. Okay? So only on one side. So you saw the tongue base come forward. I can make it happen here. On the right side here. But look at the side walls of the throat. Look how they straighten. I think that's the main mechanism of how it works, actually, by stabilizing the pharyngeal walls. This is what happens to the tongue. So obviously you can't talk when it's on, but you just press pause and you can talk at that point if you wake up at night. And it doesn't wake you up from sleep, that's the key. So what about the new wave? This is the new wave that I'm also working on here. So I had to do that. So new wave is basically external power source and external stimulation. So there's a device by this company called Nixoa, where essentially this implant, it looks a little bit like the Star Trek Enterprise, on purpose actually, gets implanted under your chin. Okay, and there it is, it's being implanted by itself. And then you wear this skin patch with a button, and the button is a transmitter as well as a power source on your chin. And that's essentially the video of what happens, and patient goes to sleep with it like this. And so not difficult to do, to just put something underneath your chin and press the start. Although for some people that might be even too much to do. We are much more lazy than we can ever imagine. So this is the latest sort of technology in sleep apnea. It's now being tested in Europe and Australia. It's going to be MRI compatible, bilateral stimulation, and the BLAST trial is up and running. So should be done shortly, actually, for this particular device. So it's a new frontier. It's an exciting era in medicine. Sleep by itself is unbelievably an explosive field right now. There's no shortcuts, unlike this truck driver. And I thank you very much for your attention.